Thank you for your interest in Kaiser Permanente Redwood City Pain Management Program. This orientation video is designed to provide you with information about our program so that you can make an informed decision about your participation with us. In this video, we will talk about what pain is, basic pain science, and chronic pain syndrome, what the KP Redwood City Pain Management Program is all about, our discharge criteria, and next steps. Pain is always a personal experience that is influenced to varying degrees by biological, psychological, and social factors. Pain is subjective. Our experience of pain is unique to us. Our nervous system and brain are responsible for our pain perception and sensation. How we perceive and process pain depends on our prior experiences, responses, and emotions we attach to our pain. What is the difference between acute and chronic pain? The duration for acute pain is generally less than 6 months, and individuals experience minimal to no pain after the original injury has healed. Conversely, the duration for chronic pain is more than 6 months and persists even after the original injury has healed. The cause of acute pain is known and localized in the area of injury. For example, I am experiencing pain in my low back because I strained myself while working. However, the cause of chronic pain is unknown and diffused. For example, I continue to experience pain in my low back even after my low back has recovered. But now I am also experiencing pain in my hips and down my legs whenever I move. Individuals often experience intense acute pain after an injury, depending on the cause. Contrary, the intensity of pain in individuals with chronic pain fluctuate between mild to very severe. Pain can be compared to our personal alarm system, a car alarm. For example, when we experience acute pain from a sprained ankle, the alarm system goes off to alert us of the injury and to warn us of any danger or harm. If I injure my ankle, the pain is going to keep me from going on more hikes or doing hip hop dances. To care for the ankle, I rest, ice, compress, and elevate my ankle so that it can heal. However, as we experience pain for a long period of time, in the case of chronic pain, our nervous system gets overly activated and it becomes more sensitive over time. Even the feel of fabric on our skin or a gentle touch from others sounds the pain alarm system. Therefore, chronic pain is similar to a faulty car alarm, which sounds when a harmless pedestrian walks by. Chronic pain no longer serves to warn us of danger. For acute pain, medication, rest, ice or heat are generally effective, and we get better over time. In chronic pain, many different treatments are recommended, and the effects of medication and procedures are variable. There is no single medication or treatment that can eliminate the pain. Instead, a variety of treatment options combined with individuals' motivation and hard work can dial down the intensity of chronic pain so that individuals can live their life. Good news, our overactive nervous system can be unlearned, not just with medication and procedures, but with a whole person or mind-body approach to pain treatment offered here at the Pain Management Program. As mentioned previously, for individuals with chronic pain, the brain and nervous system is oversensitized and hyperactive. The pain you experience is real, and it is not your fault. Our brain and nervous system are built to protect us, perhaps overprotecting in the case of chronic pain. In chronic pain, it is not a hardware problem, but a glitch in the software program that processes danger signals in the body and in its interpretation of our sensory information. Good news! We can reconfigure the software program in our brain and nervous system through the whole person, mind-body approaches. Through our pain management program, you will learn adaptive and productive pain management skills to retrain your brain and nervous system so that your pain signals will be less intense. When the pain is more in the background than in the forefront of your mind, you can function and live your life based on what is important to you. What does it mean to have chronic pain? Chronic pain is more than just a result of biological or physical components. It is also comprised of psychological and social factors that are important to daily living. Although pain usually serves an adaptive role, it may have adverse effects on function and social and psychological well-being. Chronic pain affects not only our physical function, but also our mental health, sleep, stress, energy, motivation, nutrition, occupation, and relationships in our lives. All these factors can in turn contribute to our pain condition and influence how we behave, feel, and think about our pain. These factors listed here have an intricate relationship with pain, and all are interconnected. For example, feeling depressed or anxious leads to increased distress in our lives and may worsen chronic pain. Vice versa, chronic pain may exacerbate our mental health conditions. The Kaiser Permanente Redwood City Pain Management Program is a comprehensive, multidisciplinary, team-based approach to improve your physical function. Our goal is to help you learn how to manage your pain by utilizing non-opioid modalities so that you can return to a better quality of life and to increase your physical function while reducing your sense of suffering. At Kaiser Permanente Redwood City Pain Management Clinic, we take a whole person approach to pain care because we recognize that pain is a complex and multidimensional experience. Therefore, treatment focuses on all aspects of a person's health, life, and relationships. We will work with you to learn adaptive and productive coping strategies to improve your day-to-day functioning and to live a meaningful and fulfilling life. Our goal is not on eliminating your pain, but to reduce the intensity of your pain so that you can live your life based on what is important to you. We are a non-opioid pain management program. We do not prescribe or manage opioid pain medications. If you are currently prescribed opioid pain medication, your current prescriber will continue to manage your opioid medications while you are in our program. Here at the Redwood City Pain Management Program, we offer an integrated, multimodal approach to pain management, medication and procedures, psychological support for those who struggle with life or who need additional mental health support in addition to pain, individual physical therapy to help improve your mobility and day-to-day functioning in a graded manner. A key component of our program is the 8-week, 2-hour per week, and 1-day-a-week pain education class to learn pain management strategies. We offer a workshop that teaches a wide range of pain management skills and self-care strategies, gentle conditioning exercises and body movement, relaxation training, pacing, mindfulness, thought reframing, stress management, improving sleep, managing flare-ups, and various other helpful tools. You will learn and practice these self-care skills in a safe and supportive class setting in person or online. Participants often report invaluable support from the providers and other participants in the classes. Complementary and alternative treatments such as acupuncture or integrative medicine. Although we do not have an acupuncturist in our pain program, we can refer patients to this service within the KP system. Pain is complex. Evidence shows that a multidisciplinary, team-based approach is the most effective way to help people manage chronic pain. At Kaiser Permanente Redwood City, the pain team consists of a program assistant, pharmacist, physical therapist, psychologist, nurse case manager, and pain physician. Each provider brings a unique perspective of their specialty area to pain assessment and treatment. We will work together with you to evaluate your pain condition and to develop an individualized, comprehensive treatment plan for your pain management. Our team monitors your progress regularly and makes adjustments as needed. Because you are the most important member of the team, we make decisions and adjustments in a collaboration with you. It takes a team for a whole person, mind-body approach to pain management. It is our privilege to be with you during each step of your journey in pain management. If you are interested in the program, here are some expectations. We encourage you to keep an open mind to different pain management modalities other than just medication and procedures. Medication and procedural treatments to chronic pain are found to yield short-term benefits. Research and experience has shown that long-term benefits and improvements are achievable when treatment plans incorporate engagement in regular physical activity and proactive pain management skills along with medication and procedural pain treatments. You will be evaluated by multiple providers on the team. There may be high volume appointments in the first 6 weeks of participation as we get to know you and help you settle in on your path to pain management. But know that these appointments will be spaced out after the initial burst of appointments depending on your pain condition. If you are still looking for a cure to your chronic pain, this is not the program for you just yet. However, if you are curious on how to change your relationship with your pain and willing to try different treatment modalities, this is the program for you. Are you ready to participate in an intensive pain management program and be motivated to regularly practice the pain management strategies learned? If so, this program is for you. Do note that pain management improvements are generally witnessed in individuals who are motivated to incorporate and practice the pain coping strategies they learned from the program into their daily lives. Commitment to all recommended aspects of the program and your active participation in the classes are essential to functional improvement. We are a time-limited specialty service. We will return your pain care to your primary care clinician if you meet any of the following conditions. 1. When your pain is satisfactorily managed or you have achieved a reasonable degree of functional improvement. 2. When we have no additional therapeutic options to offer. You are either doing so well that we have nothing to offer, or you have tried everything and nothing worked. 3. When we offer a whole array of treatment options and you either decline or do not follow through with the recommended treatment plan. Or 4. If you miss 3 or more appointments with any of the pain management team providers, for example, pain physician, pharmacist, PT, RN, psychologist, or class. Missed appointment means not showing up for in-clinic appointment, not answering a telephone/video appointment, or canceling with less than 24-hour notice. It is very important to cancel your appointment at least 24 hours in advance so that we can offer that spot to another patient. If you are interested in the Kaiser Permanente Redwood City Pain Management Program, the following are steps on how you can get started. Step 1. Please complete the pain orientation forms sent to you by our program assistant via the kp.org secure message. It is important to complete the forms and return them to the pain program before your first appointment. Step 2. You are scheduled for orientation to our pain management program with a member of our team to discuss an overview of services and to address any questions you have about the program. Step 3. An appointment with a pharmacist or RN care manager for thorough review of your pain history, medication, medical, surgical history, and your past experience with various pain treatments. Step 4. You will be evaluated by our Redwood City Pain Management Team members. To begin the process, please complete the orientation forms sent to you by our program assistant via the kp.org secure message. Please complete these forms before your first appointment with the Pain Management Clinic. To access the forms, please click on the hyperlink kp.org. If you have trouble logging onto your kp.org, please contact Member Services at 1-800-464-4000 or TTY 711. If you have questions about the forms, for example, how to send the forms back to the clinic or difficulty opening the documents, please contact the Pain Management Clinic at 650-299-4396. Again, 650-299-4396. Note that the completed forms will be a part of your medical record. Lastly, we thank you for your time and look forward to meeting you and being a part of your journey in managing your pain.